Performing Hand Hygiene. Hi, my name is Peyton Burke, and I'm a University of South Alabama student nurse, and I'm here to perform your neurological assessment on you today. Is that okay with you?
Mm-hmm.
Perfect. So the first thing that I'm going to do is assess your overall mental status using ABCT, which is your appearance, behavior, cognitive abilities, and your thought processes. So just looking at you, I can see that you're sitting upright. You appear to be calm. You appear to have good hygiene. You're well groomed. You're dressed appropriately. Do you have any thoughts with or any problems with depression or anxiety?
No.
Or any suicidal thoughts?
Mm-hmm.
Okay. And if I had any, if you had answered yes, or if I had any reasoning behind thinking that you might have those thoughts, then I could go get a screening tool in order to assess that further. So now I'm going to ask you a couple questions to assess cognitive function. Do you know your name?
Connor McRae.
And where you are?
Clayton, Alabama.
And do you know what time it is, approximately in the day and the year?
About 7:30 in 2020.
Okay. And now I'm going to ask you a question about recent memory and remote memory. So do you remember what you had for dinner?
Ham and macaroni and cheese.
Okay. And I know that to be true because I was there as well. And then for remote memory, do you know who the president was before President Trump?
Obama.
Okay. Now I'm going to ask you a question about abstract thinking and then a few questions about your judgment. So for abstract thinking, if I asked you what it was like to find something like a needle in a haystack, what would that mean to you?
Hard to find.
Okay. And then if I were to ask you if you were driving down the road and you saw blue and red flashing lights, what would you do?
Pull over.
Okay. And what would you, or where do you see yourself in the next 2 years?
Financially stable with a good job.
Perfect. So all of those questions you answered appropriately, so I can say that your abstract thinking and your judgment and your memory are all intact and well. So now I'm going to go on to assess all 12 of your cranial nerves. So the first one is cranial nerve 1, which is the olfactory nerve. For that one, I'm going to have you cover one nostril and sniff. Cover the other one and sniff. Okay? And that was the motor portion. So for the sensory portion, I'm going to have you do that same thing with your eyes closed, and I'm going to put a scent under your nose, and I'll just have you identify it, okay? So close your eyes and cover one nostril, and I'll have you smell.
Mints.
Okay? And then cover the other nostril for me. Okay, smell.
Peanut butter.
Okay, perfect. So you were able to correctly identify those. So I can say that your cranial nerve number 1, the olfactory nerve, was intact. So for cranial nerve number 2, which is the optic nerve, I'm going to, if I was in a clinical setting, I could have you stand 20 feet away from a Snellen eye chart and have you cover one eye and read the lowest line possible. We don't have that here today, but I do have my handheld vision screener. So I'm going to hold this about 14 inches away from your face, have you still cover one eye, and then I'll have you read the lowest line possible.
4, 2, 8, 7, 3, 9.
Okay. So you do have 20/20 vision, which is the gold standard. If say you had 20/50 vision, that would mean that you could see at 50 feet what the average eye could see at 20 feet. So, and then I would usually test this bilaterally, but we're not going to do that today. So, the next optic nerves the next cranial nerves that I'm going to test for are cranial nerves 3, 4, and 6, and optic nerve, the second cranial nerve is intact. So for 3, 4, and 6, which is the ocular, motor, trochlear, and abducens, I'm going to do a series of tests called PROLAC, and then we'll do the 6 cardinal fields of gaze. So for PROLAC, I'm just going to have you look straight forward at me. I see that your pupils are round and equal in size, and they are about 6 millimeters in diameter. So now I'm going to test for direct and consensual light reflex. So I'm going to shine this light in your left eye. Just look straight forward for me. Okay. I'll give you a second. When I shine the light in your eye, it did constrict. So now I'm going to, that eye did have direct pupillary light reflex. Now I'm going to shine it back in the left eye and look at your right eye for consensual light reflex. Okay? And that one did constrict as well, so you have consensual pupillary light reflex as well. So now I'm going to have you look at the TV for me. And then look at my pen light. Okay. So when you looked at the TV, your eyes dilated, and when you looked at the pen light, your eyes constricted for accommodation to what you were looking at. And now I'm going to have you just follow this in. Good. So your pupils did turn in on their axis for convergence. So your pupils were equal, round, reactive to light, and they accommodated and converged. So finally I'm going to do the 6 cardinal fields of gaze. So I'm just going to have you follow this pen light with your eyes. Don't move your head. Perfect. So for that one, I was checking for parallel tracking, which I did note. Both of your eyes followed it at the same time, and I didn't note any nystagmus. So cranial nerves 3, 4, and 6, the ocular, motor, trochlear, and abducens were all intact. So now I'm going to jump back to cranial nerve number 5, which is the trigeminal nerve. For that one, I'm going to have you clench your jaw really tight, and I'm going to palpate your masseter muscles and your temporal muscles. And I feel good strength there, and then keep me from opening your mouth. Good. So the motor portion for that is intact, and then if I could just have you close your eyes and tell me when you feel me touch your face.
No, 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 no.
Perfect. So motor and sensory portions of cranial nerve number 5, the trigeminal nerve, are intact. So now for cranial nerve number 7, the facial nerve, I'm just going to have you make some funny faces for me. So can you smile, frown, puff out your cheeks, raise your eyebrows really, really high, and then pinch your eyes shut and keep me from opening them. Good. And then for the sensory portion of that one, we would normally put something sweet, sour, or salty on the anterior 2/3 of your tongue. We're not going to do that today. So the motor and sensory portions of cranial nerve number 7 are both intact. So now for cranial nerve number 8, the acoustic nerve, I'm going to do a whisper test. So I'm going to stand about 2 feet away from you, and I'm going to cover my mouth, and I'll have you occlude one ear, and I'll say a word, and then I'll have you occlude the other ear and repeat the word.
Happy.
Okay, other ear.
Purple.
Perfect. So you were able to correctly identify both words. So cranial nerve number 8, the acoustic nerve, is intact. Now for cranial nerves number 9 and 10, the glossopharyngeal and the vagus nerves. For the motor of number 9, I'm going to have you open your mouth and say ah.
Ah.
Okay, and your uvula was midline, it didn't deviate to the left or right, and it rose on phonation. So the motor portion of number 9, the glossopharyngeal, is intact. And then for motor of 10, we would usually use a tongue blade to push down for your gag reflex, but we're not going to do that today. And then for sensory, for both of 9 and 10, I would usually put something sweet, sour, or salty on the posterior 1/3 of your tongue. We're not going to do that today either. So motor and sensory portions for 9 and 10, glossopharyngeal and vagus cranial nerves are intact. So for cranial nerve number 11, the spinal accessory nerve, I'm going to have you push up your trapezius and your sternomastoid muscles, and I'm going to push down, try to resist me. Okay, good. And then can you push against my hand with your face? And the other side? Good. So cranial nerve number 11, the spinal accessory nerve, is intact. And for cranial nerve number 12, the last one, that is the hypoglossal nerve. For that one, I'm going to have you open your mouth for me. Stick your tongue out. Okay. And say ah. Okay, so your tongue is midline. It doesn't deviate to the left or right. And now I'm going to have you repeat 3 words for me. Light.
Light.
type, and dynamite.
Dynamite.
Perfect. So you were able to correctly identify and repeat those words clearly. So I can note that cranial nerve number 12, the hypoglossal nerve, was intact. So now I'm going to test your motor system to make sure that your cerebellar functions are intact. So if I could just have you stand up for me. And I could have you walk that way for me. Okay. And then on the way back, I'm going to have you tandem walk. So heel, toe, all the way back. Good. Okay, that's good. And throughout that entire process, I was noting that your gait was normal and rhythmical. On the way down, I didn't notice any swaying, abnormal swaying, and then on the way back, when you tandem walk for me, there was just a little bit of minimal swaying, which is normal. So the next thing I'm going to do is a Romberg test. So I'm going to have you stand up for me again, and I'm just going to have you stand with your feet together and your arms at your sides, and I'm going to have you close your eyes, and I'm just going to be standing behind you to support you throughout this entire process. And note any swaying, and I don't see any. I would normally do this for 20 seconds, but you can go ahead and sit back down. So I didn't notice any excessive swaying. There was a little bit, which is to be expected, so you had a negative Romberg test. And so now now I'm going to go on and test your sensory system. So for that one, first I'm going to test using my hammer, and then after that I'm going to test for all your reflexes. So if I can get this out of here, I'll do that. Okay. So I'm just going to show you, this is sharp, and this is dull. Okay. So if I could have you shut your eyes for me and tell me if this is sharp or dull.
Sharp.
Okay.
Dull. Dull. Sharp.
Okay. And you were able to correctly identify those. So all of your the sensory portion of that is correct and intact. So for now I'm going to test all of your reflexes. So I'm going to test your biceps reflex first. So I'm going to go ahead and, okay, and we'll just find that tendon, and I could just have you relax for me. Okay, perfect. So that one was a 2+, and now I'm going to test for your triceps. So you can just rest your arm. Okay. That one was a 2+. And now I'm going to test for your brachioradialis. That one was about a 1+. The next one I'm testing for is your patellar. So just relax for me. Okay. That was a 2+. Yeah, if I could have you take your sock off for me. Okay. And I'm going to test for your Achilles reflex now. That was a 2+, and then I'm going to test for the Babinski. Okay, and that one was a negative Babinski, or positive Babinski. So, perfect. And then throughout that entire process, I was conducting a Glasgow Coma scale. The lowest that you can get on that is a 3 and the highest is a 15. And anything equal to or below a 7 is indicating coma status. So I'm going to go ahead and give you a perfect score of 15. You get 4 points for consensual blinking response to me throughout this entire process. You get 5 points for verbal response, so you've been answering me throughout this entire process, and then you get 6 points for all of your motor functions, which